We will go ahead and get things kicked off. Welcome, everyone. My name is Hannah Edlin. I'm the Policy and Advocacy Director here at Kentucky Youth Advocates, and we are so excited for you to be here with us virtually today for our webinar, Harnessing Opioid Settlement Funds for Lasting Impact. We will be recording today's session for those that will not be able to attend, and it will be sent out with some other follow-up resources following this webinar. During our time together, you will gain insight into the impact and allocation of the opioid settlement funds, information on the latest notice of funding opportunities, some details on the revised application process, and you'll have an opportunity to have your questions answered directly by our commission leaders here today. To kick off our time together, I'm going to hand it over to Barry Allen, who is one of our grant makers with the Bloom Kentucky Initiative. Through his thoughtful vision and leadership, Barry has galvanized coalition members across every corner of the Commonwealth in hopes to mitigate adverse childhood experiences through policy change. I'll kick it over to you, Barry.
Well, thank you, Hannah, and good morning to all. It is my joy to greet each of you on behalf of the 32 grant-making organizations from around the Commonwealth that formed a coalition in 2019 to engage for the first time ever in a united statewide public policy advocacy initiative to reduce the impact of adverse childhood experiences and to give Kentucky's children and families reasons for hope, which in turn will result, we know, in a healthier, more prosperous future for all Kentuckians. This initiative was branded as Bloom Kentucky. And what is important for you to know, and what is so unique, exciting, and satisfying about Bloom Kentucky is these grant makers decided to move out of our comfort zones of grant making and into policy advocacy as a new part of our missions to escape the trap of tunnel vision from which we had been operating for decades. We are indebted to the Kentucky Youth Advocates team for their capable and competent assistance as the backbone organization for this vital initiative. And we are pleased to host this webinar, knowing there is a high correlation between addiction and child adversity. It is my hope you have come today out of a sense of urgency, with a commitment to upstream thinking, with a conviction to stop the endless cycle of reacting and to start the revolution of preventing, and to move from just taking care of the problem to ending the problem. In the realm of real estate, it is said the three most important factors are location, location, location. In the realm of addiction, the three most important factors are prevention, prevention, prevention. And how fortunate we Kentuckians are to have the benefit of the cordial and competent leadership of Chris Evans and Jesse Halliday in stewarding the financial resources entrusted to the Commission to enable your organizations to stop this terrible scourge. During this session, you will discover that you and they are two hearts beating as one in this once-in-a-lifetime opportunity. So thank you, Chris and Jesse, for your wisdom and guidance and for sharing this time with us this morning. The floor is yours.
Barry, thank you very much for that introduction. And first of all, I want to make sure to thank everybody who's joining us today. One of the things that we've recognized and want to make sure that we do as the commission representatives and as a body is to provide clarity to people about the process. And so what Jesse and I are going to do today with you is walk you through, especially with the new application process going on, where the commission's at. The way we're going to break it down is I'm going to talk to you a little bit about the why things are the way they are and why we've basically patterned and pushed and developed things to run in the way that they're going and the priorities and how that's been established. And then Jesse's going to get into the nuts and bolts of what things look like in terms of the application and the process. We've learned that people have questions on both sides of it and want to understand the background for how the decisions are being made in terms of what the commission is doing and what that looks like, and also the practical side of from the application of what it looks like what they need to do and what they need to consider as they're going through that and making the applications. So with that, we'll go ahead and get started, and we'll walk you into a little bit of what we're doing with the commission. So what you'll see in front of you now is the grant timeline. And I should point out, I expect everybody who's on this call, as Jesse has pointed out, we've become a lot more popular in the last few weeks as the grant application period is open. Again, our role as the commission is to oversee and make the awards of the state's portion of the settlement funds. And so what you'll see in front of you is the grant timeline. December 2nd is when we opened up the process. We had made notifications before that this was going to happen. The process and the applications open December 2nd, and they will close on the 17th of January. We recognized and we wanted to make sure that we're able to move this in a way to get onto the state fiscal calendar in terms of the work we're doing. So we wanted to make sure that, understanding this was some of the holiday time, that we kept it in through mid-January, so people had time after the holidays to continue to work on this and move forward. You'll see the important time frame that people always ask us about is, what does this award decision look like in terms of time frame? And we're anticipating March, April for that to take place, when we can, after the commission has had the opportunity to review all the applications, go through, vote, and make that award process to folks, and understanding in the March, April. And then, as I mentioned earlier, you'll see that July 2025 contract award timeframe. Again, what's important for that date is we're trying to make sure that we can get on the same calendar as the state fiscal bodies, and that allows us to do that and to issue those contracts and initiate the process in the beginning of July to make sure that everybody is in that process. So that's what that looks like. Again, what are the grants going to be focused on, and what does that look to be? Is the things in front of you. You know, they must provide prevention, treatment, or recovery service for individuals who have or at risk of one of the following: opioid use disorder, or OUD, and comorbid polysubstance use, co-occurring mental illness, or co-occurring substance use and mental illness. So as people will sometimes come to us and will have very well-reasoned and understood and important programs and projects that they want to get involved in, that they want to get a grant for. If they don't meet those criteria, even though it is a strong need in their community, we may not be able to fund it. And so who can apply for the funds from the commission? And you'll see one of the top things to make sure everybody asks, hey, sometimes we get, can I as an individual do this? And we said, look, you have to be registered as an entity in good standing with the Secretary of State. It can be a for-profit as well as nonprofits. Obviously, what we mostly hear from nonprofits, but for-profit organizations and entities can apply, as well as government entities, counties, cities or towns, municipalities can apply for grants from the state. We recognize that there is sometimes confusion about that, because people understand that some counties and municipalities have received funding also, but there's nothing in the programs or the stipulations that prohibits them from being able to apply to state funding also. This year, we want to make sure that there's some clarity in terms of what the award information looks like and can be. We're maintaining the ceiling of $1 million for awards. That is the same as was the last go around, and the commission has decided to maintain that award ceiling. It's also want to make sure that's going to be in asking people for a 12-month budget. We need to make sure that people are clear that that is what's anticipated from the commission and expected, is that you will understand as you apply for this process that you should be having an expectation that you can initiate your process as soon as possible to that July deadline and have a 12-month budget. That's what we're asking people to do. They were also asked about the cost sharing and matching requirement. You know, hey, do we have to have match funds? Do we have to do those things to move forward with an application? And the answer is no, you don't. However, those applications that are able to show that, they may be demonstrating to the commission that they are going to be able to be sustainable. One of the things the commission wants to do, and the members want to make sure that happens, is that it doesn't just put funding for a program for 1 year, or this is the only way that this organization or this effort or project is going to be able to survive. Understanding that the commission receives fundings based on what's submitted from the settlements, we can't guarantee that the funding each round is going to be exactly the same. We're taking efforts and strides to keep it in a range which the commission has some regularity in terms of being able to support things, but we want to make sure that people are clear that this is not a line item in the state budget. And so we can't guarantee that funding that you receive this year would be what you would receive next year. So any opportunity you have to demonstrate sustainability, it's helpful for the commission to understand that they are funding something that will have legs. As we're talking, with Bloom, that's some of the things that people use. It's like planting the seed. We want to make sure it can grow. We want to make sure that it's going to be able to sustain itself. You also see the service delivery date. As I mentioned before, we want no later than 90 days from receipt of the contract is what we're looking for. We want to make sure that people are clear that we're expecting that they are able to execute within that time frame so that the money is put to use so that it can be done within the budget for time frames. And we really aren't holding on for people waiting to get into that time frame that goes later on. The reporting requirements, there's a lot of the state regulatory requirements are listed there. I'm not going to go through and read them all. But one of the things that's included is what you are required to submit financial reports and agree to participate in program evaluation and monitoring activities. One of the things which most of you may have heard, or if you haven't, we have started conducting site visits to those programs who've received fundings and grants from the commission. So we are doing that process, part of the evaluation and monitoring of activities. But also just want to point out that we are not looking for gotcha moments. We want people to be educated. We want people to understand what the process looks like, and we want to support them in the work that they're doing. So we're not looking to come audit to gotcha. We want to make sure that what's there and the process is there. As you'll see before, the parameters, funds can't be used to purchase land. They can't be used for anything or construction which requires permitting. The review committees may request budget modifications be made prior to award. The commission may look at a grant application and say, we'd like to support this portion of it, but there is another portion which we don't feel it's appropriate to award or to support at this time. And so there may be an ask to go back and to modify that request so that the commission can see if it's available to make that award as they would like to intend. There is also still a prohibition of purchasing vehicles. The commission recognizes that transportation is a barrier to a lot of things, but there are a number of things that happen or relate to the purchase of vehicles. So what the commission is recommending and is looking at and will consider innovative transportation models and what we've listed as voucher programs as something that the commission has seen and is willing to support, understanding that transportation is a barrier for folks. And then you'll see the two final things, that the proposal should reflect the most effective and sustainable use of funds. Like I said a moment ago, the commission members really want to make sure we look at this when we're voting and going through is, hey, can this last? Can this live? Can this move on? We want to make sure that we're supporting programs, but we also want to make sure that those programs are going to have a chance to thrive and grow and then eventually become sustainable on their own. Multiple agencies can partner in the application process, but only one may serve as the fiscal agent. So understand that if you are talking about submitting your application process, that's something that you will have to have that discussion internally to make sure everybody is on board with that. The prevention, as Barry mentioned, is one of those priorities that the commission has put front and center in terms of the work that it does. In looking at applications in the past, the commission has identified really that it would like to receive more prevention-related applications to be able to support that more. One of the things that you'll see, or the two things that you'll see really that are listed there, is youth-focused prevention. We're defining that as up to age 26, and in-school and out-of-school programs are things that the commission is looking to support. Also, those overdose reductions efforts. We talk a lot about naloxone distribution, mobile clinical services. Those type of things that also lead into the prevention space are things that the commission has gone through and said, hey, we want to be a part of. And just to go back a little bit, that is one process that the commission went through this summer and into early fall was, what are the priorities of the commission? Understanding there's great need and there's going to be more need than there is money. How do we prioritize what we see that we can go into and try to lean forward into and let organizations know that this is what we're looking to? Again, the goal is to be the most effective in the use of the money, trying to make sure that it goes to the places where there's the most need and those things that go through. There's needs, or I shouldn't say the most needs, where there is not as much support for the needs. And so that's part of the things. There's a lot of great programs which the commission will see and would like to award on, but one of those things that comes back is that there's just not funds to support everything. Last cycle, we awarded $12 million, but we had requests for more than $81 million in funds. So we often tell people, do not look at if you get an award from the commission as a program as the commission saying, it's making some determination about the quality of your program. It simply comes down often to making choices about how to best use the money in ways to help change the trajectory with what they can and what's in front of them at that time. If you can go and move to the next one. And then treatment and recovery. Those are the other two funding priorities from the commissions. And when we talk about that prioritization piece about it, you'll see the number 70.34 beds per 1,000 population 22. We have the highest rates beds per capita in the country. And so that is something which we're proud of, but that also makes sure that when the commission looks at that, it understands that when people put in an application saying that, hey, they want to do something treatment bed related, you need to show the need in your area of service for that. We recognize there may be beds across the Commonwealth, but they might not always be in the place where somebody needs them. So again, that is something when doing an application, people need to make sure they clarify the service gap for the population they serve. And then the last one that I'll hit is for recovery. The commission has looked at this again as these points and identified the areas below as one of those places where it would like to see and support funding, supportive housing, transportation, as I mentioned earlier, employment support, recovery community centers, and family togetherness. Those are things as Bloom works and as KYOAAC and the other organizations that are here talk about, is building up those families and making sure that there's a holistic approach to recovery. And that's one of the things that the commission has identified in terms of that. So that's why we've gotten to those places. The commission wants to, again, make sure that the money gets spent in ways that can last, in ways that can create programs which will serve for a long time, and wanted to make sure that there's clarity about what they're going to support this year. It doesn't mean that these are the only things it supports, but that's the priorities. And again, I ask you as a voting member, if when you are doing your applications, make sure you clarify how your program supports your service area and the needs in your area. So that's the why behind it. And I will turn over to Jesse for the details about moving forward with the application process.
Thanks, Chris. Thanks again to all of you for being here today. So in addition to deciding where they wanted to put priority areas of funding support, the types of things they wanted to support, the commission also identified some specific criteria that when they read through your application, though they will look at all portions of your application, these are some areas that will have some highlighted importance to them that they are really looking at carefully. So projects that demonstrate strong collaboration. In other words, if you're partnering with someone or if you're saying that you're partnering with someone, they want to see a letter of support. They want some demonstrated evidence that you have indeed started the process, that there is a collaboration that's working. So while only one person can be the fiscal agent, there's places on the application for you to put letters of support and other information that shows how you are partnering. They really want to see people working together and building coalitions and utilizing other resources to do the work that they are proposing be done. They want to see projects that expand or enhance services. So in the statute, supplanting is referenced, and supplanting, which we define as replacing funding of a recipient's existing program with awarded funds, is discouraged by the commission. Not saying that you couldn't ask for some supplanting of these funds, but the commission is saying they don't really like that process and they discourage you from using this to replace funding you already have, unless that funding has completely gone away. For example, you no longer have ARPA funds to support something and you need it's a no longer a revenue stream or a project stream. That's not considered supplanting. Projects that involve recovery housing, and only if they involve recovery housing, must comply with the state accreditation requirements, become NAR certified, or be in the process to be NAR certified. That's something they will insist on. Projects that address or fill service gaps in particular regions, so geography, they will be considering what else is available in regions. This is the one that people is new and is also still to be all the details worked out. But if you were a recipient previously and you are asking for funding to continue the work that was done, so you have started a recovery program, if you're going to request continuation for that program as it was originally funded, no additional expansion, no additional staff, but simply to keep the staff you already have engaged and to keep the program going for another year, the commission is asking that you reduce your ask by 25%. This is because the commission, as Chris said earlier, recognizes that this money is not long-term sustainable, is not guaranteed year over year, and they'd like to try to encourage organizations to find new funding streams for the work. But they also recognize that a program can't be up and operational and self-sufficient necessarily within 12 months. So they are willing to consider continuation funding. One question we've gotten a lot is, if I'm including an expansion along with continuation funding, you can do that within the same grant application. You should consider what was previously funded and what the expansion will cost and ask for those expansion costs. But this will also be something that the commission has to take into account on a case-by-case basis. So if you are asking for continuation funding and you don't include a decrease in your original funding award, they may come back to you and say, we need you to decrease that, or they may say, well, we gave them some guidance to try to show sustainability. And so just want to be clear that they're asking people to start stepping down their ask for things they've already been funded for through this grant. We'll have time for more questions on that later if we need to do clarification. Just want to post here, this is where you find the applications. It's on the IntelliGrant system. You can also find it on the Attorney General's webpage, on our page on the OAG, and I think Hannah put that in the chat for us. But in order to actually start your application, you will have to register with IntelliGrants. There is a step related to that. But if you just want to see what the applications look like, they are posted in PDF form on the AG's website, which is something we've not been able to do before. And we'll just save some step if you're trying to see if you can meet all the requirements. You can look at a PDF version of it ahead of time. Here is that AG's website. Just to talk a little bit, we've done a lot of work in the last year. We know this is a complicated application. We know that the first versions weren't always that easy. We've heard a lot of feedback. We've taken a lot of feedback from folks over the last year, and we've redesigned it. There's still a lot of information that's required. It is a state contract, so we have to follow state contracting rules, which requires us to ask certain things from a processing standpoint. But I did want to highlight a couple of the changes. One, if you're a charitable nonprofit, you are required to register with the Office of Attorney General. So we are asking you to confirm that you're up to date with that, and we'll be checking that you're filing the proper paperwork with the Office of Attorney General on the charitable nonprofit registration. We are also asking for nonprofits to provide their 990, which meant we could also eliminate some of the hand entry on the previous application because that information is on the 990. If you're not a nonprofit, there are other financial documents and information that you'll be asked to include as well. As it relates to funding sources, we've gotten a little more specific about this. We're going to ask you as an overall, as an organization, what other funding do you get related to substance use disorder or opioids? Some specific, like, do you get a grant from CORE? Do you get a grant from the Office of Drug Control Policy or SAMHSA for substance abuse? Not necessarily for this project, but let us know where you're getting funded related to substance use disorder, as well as including if you're getting local opioid abatement funds from your county. We want to know that if you get a state appropriation for work. So that's a little more targeted than previously we'd asked, as well as we will be asking you to identify any additional funding you may have for the specific project you're applying for. We've changed the sort of flow of the application, so it should help you just to tell a better story about what your project is and give us a better pitch about what you hope to do, how you hope to do it, who you are targeting, what gaps you're filling, those kinds of things. And the thing that continues to be a request from commission members is in your budget section to please be as detailed as you can be in your budget descriptions. For example, if you are asking for $20,000 in marketing budget, please tell us what you intend to do with that. They don't like to see broad categories with no details. So if you're saying you want something for recovery supports or barrier relief funds, please detail as much as possible how you anticipate using those funds, for what types of things, if there's restrictions on it, what you're targeting. The more detailed you can be on your budget, the better off the commission will be in terms of making a decision about your application. We are not including indirect funds this year. That had been kind of a complicated, people were asking for indirect funds in multiple ways. So you still have the opportunity to ask for operational funds. Just take into account that there is not just a blanket indirect fund percentage in this grant application. Want to clarify that it's two different applications. If you're applying in the prevention category, that's one application. If you're applying in the treatment and recovery categories, that's a separate application. So previously they'd all been done in one. The commission is hoping that this will get some more focused projects. You are able to apply in both categories, but I give you the caveat that then you have added to your own competition by competing against yourself. It is still one pool of money with no distinct pool for prevention and a distinct pool for treatment and recovery. So all of the applications will eventually be weighed in their totality, even though the application process is separate. I think I covered everything that I was going to bring up, and so that we can have as much time as possible for questions.
At this time, if you have any questions, feel free to come off mute and ask those questions or drop those questions in the chat.
Joni?
Good morning. I'm wondering if a single organization can submit more than one application in the same category if the projects are sort of stand exclusively. So for example, if it's an application where it's transportation dollars that don't necessarily weave into the program, that would be housing, or if that should be encompassed in one application, and then the committee would make a decision about the features of that application and that program.
I think if they're two distinct projects, then you could apply separately, or say you have different partners for each project that you want to highlight individually. Again, the caveat will be you're just competing against yourself, right? So which one do you, it will be hard for the commission to know which one is most important to you, right? If they were to only be able to award your organization one. So Chris, do you want to add something to that?
No, I think that's the same line. Just I know that's in terms of the commission discussions, that is part of the thing will be, okay, if we only have so much money, what would be more important to the organization to support?
Is that helpful, Joni?
Yes, thank you.
Okay. I see the question about administrative limitations. Jesse, could you clarify sort of what you mean by that?
Yes, hello. Are we allowed to apply for like the de minimis rate? Are we allowed to include indirect rates for staff?
Yeah, so no indirect is going to be allowed in this application, but you are allowed to apply for staff, and staff fringe is calculated at the rate that you would enter your fringe. If there are indirect costs you want to line item as an operational cost, you can do that. We're just not doing a blanket indirect.
Okay. What about the de minimis rate? Are we doing that?
Can you clarify more?
Okay. It's just basically an admin cost. Is there any admin cost allowed?
Not specifically in like just a blanket. No.
Okay. Thank you.
Mm-hmm. I see Olivia's question. You can submit for both grants. Again, it's the sort of competition for yourself. So if they're not going to award 2 grants to one organization, how would they know which one is the most important? If you're equally important and you want to put in a grant on each side, you are able to do that. And Seth, I see your question about the local allocations. Each locality sets their own process for how they determine how funds are distributed. Some have committees, some have presentations made to the fiscal court, but ultimately it's the fiscal court or the city government that determines how they will spend their local funds. The grant is not reimbursable. It is a 2-payment grant. We've gone to a 2-payment system. So you would get the first payment in July. You're required to file a 6-month financial report. Once that 6-month financial report is filed, then we will clear the release of a second payment. And then the background check requirements and campaign finance rules. Essentially, if your organization has certifications that require background checks, for example, like involving childcare or any sort of requirements that are required under the state rules around who has to have a background check in order to work in an organization, we're simply asking if you meet those requirements and you follow those rules. Campaign finance rules, the same. I think there's a link in the application around the state campaign finance rules, just certifying that you don't make donations to campaigns outside of the required state limitations. Is that helpful, Lindsay?
Yes, it is. Thank you.
There's one thing with the definition of operations that's listed. And one of the things I just want to make sure, I know Jesse and I have said this multiple times, but in terms of operations, any operational support that you need can be identified and clarified in that operational portion of it. But I will say this on behalf of the other commission members, please be willing to document, or it's helpful for you to provide the most clarity and details on what it is you are asking for, because that is one of the things which we have seen is the most helpful to the commission, to have clear understanding of what it is. So when you talk about, that's part of the reason for the indirect cost not being there, is it's unclear to the commission what those funds you're intending to do with them. And what the members of the commission really want to have clarity on is, what is your intent to spend these dollars on? So your ability to identify and detail that is more helpful to the commission and more helpful to your application when you do that.
Seth, I see your follow-up on the localities. So the settlement provided formulas and calculations about how each county was factored into their impact of opioid use in the state, in the Commonwealth, and the amount that counties and cities got was based on that formula in the master settlement agreement. So each county and city gets a different amount based on that calculation. You are able to look at, I think if you Google opioid settlement funds, there are some national settlements that national websites that list out by state how much each locality is anticipated to get over the life of the settlement. So there are some national resources. The state doesn't touch the county or city funds. They're all distributed from the settlement managers at the national level. And then I see the question about IntelliGrants registration. My understanding is it only takes a day or two, sometimes faster, to get your login set up. But there is an email if you haven't received your sign-in after doing it. Amy Andrews at ky.gov, amy.andrews, reach out to her and she will be able to check on the status of your account.
Jesse, it looks like there was a question on if vehicles can be leased.
They will consider a lease.
So, it just for that, I didn't see the question, but just again, make sure you detail how those other things are going to be handled and how you're going to make sure that their other costs are carried for, because the commission wants to make sure that those other costs are accounted for, and that's not going to be something which somebody comes back later and says, oh, we thought that was included in the cost of the lease. So just be clear about how you're going to make sure that you're covering the insurance for the vehicle or any of those other things that are related to the vehicle expense and cost.
I would also just add that the detail how that vehicle is to be used.
Yeah.
You know, is it for client transportation versus executive director use of travel, you know, vehicles for law enforcement or staff. If it has a client transportation component, they'll like to know why you need, and what it'll be used for. Hannah, I think I got the question about IntelliGrants, but usually just a day or two for an account to be set up on IntelliGrants.
Perfect, thanks.
My understanding is it doesn't take that long, Lindsay, but it's a process of someone entering it. I think that you can check it online. I don't have that address handy, but we will be able to check. And if you submitted your paperwork at this point, you should be in good shape. It got quiet all of a sudden.
Anybody else? Again, for us, a big part of this, and we always like to remind people that, look, we will continually be working to refine the process. And so this feedback is helpful for us, not just for this one, but for the next cycle as we move forward and go through with the commission. We want to make sure that we're clear with people. We want to make sure we understand what hurdles may be there unintentionally or that we're not aware of. So again, this is a great opportunity to make sure to help us understand the process and how it affects you. And so we just, again, recognize that we'll have to continue to keep getting better, but your help and the questions are very helpful for us. So we really appreciate that.
Joni, I see that question about a second grant cycle. We are not planning to do a second grant cycle. Our goal will be to start having yearly grant process that open in the fall. Next year, it should open earlier than it did this year. As we get more into a routine of a state fiscal year contract. and they will, and then all grants would be awarded July of the start of the fiscal year moving forward, so that we can get on a sort of more of a regular turn. That doesn't mean that there might not be specialty opportunities, or that there might not be specific opportunities that come up as we, like, for example, we've talked about an innovation grant process for research or innovation projects specifically that may still open up. But in terms of these prevention, treatment, recovery grants, we're anticipating one grant cycle a year.
Thank you. And then I'd like to follow up on that, asking, will you have a rolling number as far as the dollars spent, and will that implicate the top amount for future applications?
So we'll continue to do this yearly process and go back and review and see what it looks like. One of the things that we've talked about with the commission and look to be is trying to be fairly consistent in terms of what that is based on the settlement. What we don't want to have happen is we go through a process where we burn through all the money much quicker and then on the back end have very little. We'd like to be more consistent with what that looks like. So you can anticipate, barring some significant changes, it being in the similar range for the next several years. Again, we want to be consistent. We want to have clarity, and so people understand what it looks like and what the opportunities are.
Yeah, just to add on to that, Joni, I don't know if a lot of people understand this, but we don't have $450 million sitting in account right now. Those payments are coming in over time, and several of the companies have prepaid out their settlement for years in advance. So there may be more money at the front end because people have prepaid, but to Chris's point, we're trying to think about how to spread it out over time for consistency and sustainability, and to avoid getting to the end and having like just $1 million that we could hand out or something. So that's why that is. We don't have all the money up front, and it is continuing to come in on an annual basis.
Okay, thank you. And may I ask one more question on that? Well, actually, I have a couple more questions. One is whether or not this pot of funding is subject to any additional litigation. In other words, is there any chance that it might go away?
No, this settlement fund has been agreed. This settlement has been agreed to and isn't part of additional litigation. Could there be additional litigation for other manufacturers or other events related to this? That is possible, but this settlement is in place. You know, as long as those companies are in business and those things are going through, that those settlements would continue. That doesn't mean if a company went out of business, that again, there would no longer be the ability to get those funds in. But the settlement is in place, and so this part of it should not change.
Okay, great. And then one more question on the multiple projects from the same organization. So for the funding year 26, if an organization applied for funding for one particular project this go around, could they apply not for the same project, but for a new project in 26?
Absolutely.
Yep.
Okay, great. Thank you.
So Jesse, really quick, I'm sorry, I'm in another appointment while I'm on this call, but this budget, is this strictly for just a year? Is this a year? The
Yes.
money that we request is strictly for the fiscal year, and there's a possibility that we can reapply next year.
Yes, it
Okay.
would be only awarded for 12 months. Continuation funding would be a whole separate application for the next year and not guaranteed, but right, 1 year of funding.
Thank you. And one more question, and I'm done. I'm trying to multitask. So did I hear that administrative costs could be covered in this, or
You can
hiring
ask,
case managers?
yes,
Hiring case managers, could some of this money be used for salaries, blah, blah, blah?
yes.
Okay.
Yes.
Salaries, and then you would list administrative costs probably under your operational requests.
And did I hear him say he wants a line item to show exactly what you're paying with the fringe benefits? You all want it well documented, right?
Yes. Your
Yes.
fringe benefits will automatically calculate from your salary ask if you're asking for fringe. But if you're asking for like Don't put in an application line that says, I want $20,000 for operational expenses. Detail what those operational expenses are. I think the bottom line takeaway is be as descriptive as you can. Connect it. Please connect the work to opioid abatement reasons. Making sure that you're connecting the work to opioid abatement is very important. It is the requirement of these settlement funds. So need a clear description. If you're in an agency that does multiple things, how is the money that you're asking for related to opioid abatement specifically inside your work? And just be as descriptive as possible.
And direct services. I know Jesse had mentioned this earlier. That's one of the things the commission members also like to see. Again, they want to make sure the money is going to services and providing support to people in the Commonwealth. So that is something that's very helpful to understand clearly how that money is going to lend towards support to helping people.
So direct services like such as housing, mental health, etc.
Yes.
Correct. As opposed to as Jesse had identified, hey, if somebody's asking for vehicle support for the director to drive to and from home, the commission would ask, okay, well, can you give us clarity on how that applies to direct services? So those are the kind of things that the commission would have questions about. I think we've probably maxed out the question from folks. It doesn't seem like there's anything else, but if there are questions, again, please let us know and reach out. That's part of our goal, is to be informative and to share and make sure people know as they're going into the process, not waiting until the application process is done. So thank you very much for all the questions today.
Yes, thank you all for the amazing questions, and a big thank you to Deputy Director Jesse Halliday and Executive Director Chris Evans for taking the time to provide this information on a Friday and spend a little bit of time with us. I want to take a moment to thank all of you that spent the morning with us, and just as a wrap up, I wanted to share a few resources with you. Kentucky Youth Advocates, we recently launched our opioid data dashboard, which is a resource aimed at helping communities make informed decisions about opioid settlement fund investments. We'll drop the link to that in the chat, and then it will also be included in the follow-up information. We invite you to explore that dashboard link and consider how this data can help guide efforts in your community. Also, I wanted to offer an opportunity for any youth-serving organizations on this call. The Bounce Coalition is currently offering free trauma-informed trainings, as well as other services for youth-serving organizations until the end of August of 2025. You will receive resources, a recording of today's conversation, as well as other tools and flowcharts in the follow-up email. Be on the lookout for that, and I hope you all have a wonderful rest of your Friday, a great weekend, and I know that together we can cultivate a commonwealth where all children and families can flourish. I hope you all have a wonderful, wonderful rest of your day. Again, my name's Hannah, and if you all need anything, feel free to reach out. All right, everybody, have a wonderful, wonderful rest of your day and a great weekend.